One major differentiating factor in the Mailafiya program is the inclusion of information technology aimed at gathering the intricate data required for health planning. The mandate to fast-track the attainment of MDGs 4, 5, and 6 got a boost despite all the challenges experienced by the Mailafiya team.
The challenges are much, but basically transportation, getting to the villages. They are so remote and there are no roads. The roads are poor, the streams have no bridges. Thank God we are using hillocks because with this we can cross some of the streams. And then the second challenge is that some of the conditions we get to see here are beyond the scope of primary health care. So they need referral to bigger centers. And these people here don't go to the referral centers when we refer them. We practically have to do whatever we can on the field because that is the only thing we can do for them.
Well, the challenges are getting to the people. The terrains are very bad and taking us a long time to get here, starting off late, and then if we must have to finish and see all the women and children, we have to stay late and getting back home very, very late.
In FCT, sometimes our medical doctors have to use the boat to cross the river in order to meet communities to give them access to health delivery, to healthcare delivery services. For now, I can see the communities' joy in having good health, and they come out. The patients that are around come out in mass and believe in the medical team. We're going to train about 100 community health workers, including nurses and midwives. We're going to bond them such that when they complete their studies, they remain in these communities to work for a certain number of years to be able to meet up with the Mailafiya even after 2015.
We will also be continuing with the Mailafiya scheme until such a time that everywhere is in service.
The commissioning of the Mailafiya scheme was a huge success. The locals came out dancing and bearing gifts in appreciation.
Very, I don't even know how many very I would say, because it's a very good thing. It's a very good thing. We actually appreciate what government is doing.
We
look at in-depth areas where we change the lives of people, and this is one of the huge successes we have recorded in the health program. The health program stems from Intel's group called the Intel Digital Health Group. Intel Digital Health Group is a subsect of a larger group at Intel called the World Ahead Initiative. And Intel's World Ahead seeks collaborations with willing third parties to provide programs that directly impact on the lives of people in areas like health, education, capacity building. And one of the programs Intel decided to take on was Nigeria's health sector, and the best way we decided to do that was taking healthcare laced with technology to the grassroots. The project tag Mailafiya was the brainchild of Intel and FCT Millennium Development Goals Group, and what we tried to do was create an all-round concept that provided both the information as well as the healthcare services for people in the rural areas.
There's improved ownership, there's improved delivery of projects, because there's a lot of flexibility on the part. You have everybody as equal partners on the table to be able to strive towards that. The federal has its own development objectives at the state level, they're closer to the people. Local governments are further closer to the people, so they're able to appreciate the priorities. What you have is federal government supporting state priorities to be able to deliver whatever their aspirations are. So the partnership is working.